This is Olivia, a father of three, a farmer, a man who not long ago was full of life. One day while working deep in the rainforest, he was bitten by tsetse flies, carrying a deadly parasite. And after that, everything started to change. His family thought he was cursed. In reality, he was dying. Olivia had sleeping sickness.
We need to keep in mind that neglected tropical diseases are very low in the list of international public health priorities and health agendas. Funding for research and developing for new treatment is typically limited, given that the potential return on investment is either very small or...
But here's the real tragedy. This disease has been curable for decades. The problem? Well, it affects some of the world's poorest and most remote communities, places where access to healthcare is limited.
We are following the WHO neglected tropical disease roadmap, which is elimination of sleeping sickness by 2030. No case, no transmission case.
And at the heart of this fight is my guest today, Dr. Philippe Neau, head of the Neglected Tropical Diseases Program at Sanofi.
So my call is all the actions we do is not just philanthropic actions for the poor. What we do is also for us. This is for the whole planet. If tomorrow we are able to eliminate the disease, this will not be beneficial only for the neglected population in sub-Saharan countries. It will be beneficial for the whole planet, for everyone. This is not just dropping pallets of medicines from an aircraft. We need to understand where people meet and where the people should receive their healthcare.
Ahead, what's next for Sanofi in global health? Are there any upcoming projects or goals that you're particularly excited about?
We are continuing to fight against this disease. We have launched a new initiative to find another drug,
Today we'll talk about the incredible progress being made, the challenges that still remain, and how close we are to seeing sleeping sickness become a disease of the past. Philippe, welcome to Drug Diaries. This is Olivia, a father of three, a farmer, a man who not long ago was full of life. One day while working deep in the rainforest, he was bitten by tsetse flies, carrying a deadly parasite. And after that, everything started to change. It began with headaches. Then came the exhaustion, so deep, so overwhelming, that he could barely keep his eyes open. His speed slowed, his body felt heavy, and soon he struggled to move at all. His family thought he was cursed. In reality, he was dying. Olivia had sleeping sickness. For decades, I have worked in the pharmaceutical and healthcare industry, but until recently, I knew very little about sleeping sickness. And I know I'm not alone, because unlike malaria, HIV, or tuberculosis, sleeping sickness rarely makes the headlines. But for thousands of people across sub-Saharan Africa, it's a matter of life and death. So what exactly is it? Sleeping sickness, or human African trypanosomiasis, is caused by a parasite transmitted through the bite of a tsetse fly. But here's the real tragedy. This disease has been curable for decades. The problem? Well, it affects some of the world's poorest and most remote communities, places where access to healthcare is limited, and treatments were, until recently, complex and dangerous. Sleeping sickness is just one of the many neglected tropical diseases that don't get the attention, funding, or urgency they deserve, simply because they don't impact wealthier nations. But that is starting to change. Sanofi, alongside partners like the World Health Organization and DNDi, have been at the forefront of a mission to eliminate sleeping sickness completely. Thanks to decades of research and collaboration, what was once a toxic hospital-based treatment is now a simple pill, a single pill that could wipe out this disease for good. And at the heart of this fight is my guest today, Dr. Philippe Neau, head of the Neglected Tropical Diseases Program at Sanofi. Philippe and his team have dedicated their careers to tackling some of the world's most overlooked diseases. Today we'll talk about the incredible progress being made, the challenges that still remain, and how close we are to seeing sleeping sickness become a disease of the past. Philippe, welcome to Drug Diaries.
Thank you very much, Shik, for this great introduction. Very well done, very impressive. Really, I'm very glad to be with you today to speak about sleeping sickness and all what we do within Sanofi and the Foundation S, the collective foundation of Sanofi, to support this program.
Thank you for the kind words, Philippe. And also, I'm so excited to have you here in Drug Diaries podcast. And it's a real privilege and an honor to have you. And I can't wait to dive into our conversation. So, Philippe, to kick things off, could you tell us a little bit about yourself and your role at Sanofi and what drew you to the work you're doing in neglected tropical diseases?
Yes, my name is Philippe Neau. I'm the head of Neglected Tropical Disease Program in Foundation S, as you just mentioned. By training, I am a scientist doctor with a PhD in molecular biology. I'm working now in Sanofi for more than 28 years
Wow.
in developing new drugs and vaccines
Amazing.
and providing access of these new drugs to the patients. For me, developing new drugs, making research is very important, of course. But thinking upfront of how we will deliver these drugs to the patients, ultimately, this is a critical thought that we need to have. I'm glad, of course, to be here today with you to share all who we have done along with this Foundation S regarding neglected tropical diseases, particularly for sleeping sickness, because Sanofi is engaged since 2001 to support WHO for tackling sleeping sickness, and we can discuss further on how far we have been able to do that. For the company, for Sanofi, the access to medicines is a continuum. As I mentioned, this is very important to have this access. And it runs from the global business units, of course, the classical commercial units, to building specific equitable access programs, leveraging at not-for-profit through the Global Health Unit, and then leveraging our foundation for the philanthropic and humanitarian access. Foundation S is a philanthropic engine of Sanofi to improve the lives of the underserved populations by catalyzing community-based solutions and expanding access to medicines. Philanthropy is a powerful tool to address global health inequity, and in this world that faces multiple complex challenges right now, is really at the maximum, I would say, from conflicts to climate change. Up to now, the philanthropic models have largely followed a top-down approach with the short-term, one-size-fits-all, which will not solve the complex challenges. That's why Foundation is structured think and do tank. With the think tank advises on strategy, and the do tank is making all the Sanofians able to support with their expertise and to extend our actions. We should imagine that the foundation is relying on all the Sanofians to leverage what we think and operationalize it. Today, more than 9,000 colleagues across the world working in manufacturing and supplies department have supported Foundation S to donate all medicines, either for emergency response, for long-term humanitarian program, for rare disease donations, or as we will mention further on neglected tropical disease program, especially on sleeping sickness. In addition of humanitarian aid drugs donations, we operate in 4 other areas where we are adding a 5th today. The first one is one of the greatest health crises we are facing now, which is the impact of climate change on health. The second one is the fact that a child dies every 3 minutes of a cancer in the world. 50% of these children live in global south, where they are far less treated than in wealthier countries. So the Foundation is actively combating childhood cancer in children with specific programs across the globe, and specifically in these low middle income countries. We are on track to eliminate sleeping sickness by 2030, which is a pillar by itself within the foundation. And as I mentioned, we have a last, more recent pillar regarding specific projects in France to care the well-being of carers. So as a result, Foundation S have advanced health resilience for the most vulnerable populations by developing 116 programs in 108 countries, reaching 24 million people through humanitarian programs, and donated 75 million worth of daily treatments and cash. So this is what we do in Foundation. In addition of Foundation S, we have broader action with what we call the Global Health Unit, because we believe that everyone should have access to healthcare, as you hear it all the time. But as mentioned by our CEO, Paul Hudson, this is not just dropping pallets of medicines from an aircraft. We need to understand where people meet and where the people should receive their healthcare. That's why we have this Global Health Unit to make a sustainable impact funding on supporting NGOs, health ministries with comprehensive support for the transition to universal healthcare coverage for
Right.
non-communicable diseases. So we are driving with this Global Health Unit also innovative healthcare partnerships, new partnerships with local startups and innovators to bring sustainable healthcare solutions for under-resourced regions to the table. So today, the Global Health Unit impacts brands and enables to make 30 medicines available in 40 countries, the most vulnerable, the most powerless countries in the world. So these medicines are considered essential by the World Health Organization and bring solutions for these people, especially in diabetes, cardiovascular diseases, and cancer. As a summary, this Global Health Unit is making non-profit for reinvesting in all in partnerships and dedicated projects to support access to patients.
Right.
And the overarching philanthropic organizations for Sanofi is corporate social responsibility. This is the umbrella of what we do with the foundation, what we do in the Global Health Unit. Complementary of what I just mentioned, there is the ambition to contribute further to better planet. Sanofi is committed to reduce the carbon emission. We have ambition to become the carbon neutral by 2030 with net zero emissions by 2050. We have already made a lot of progress on this, but we continue to strengthening our actions, reduce emissions, and also engage with our subcontractors, suppliers to activate their decarbonization activities also. So the idea is to focus on environmental profile of our products with eco-design approach for all our new products to switch from plastic. And I can tell this is a very complex industrial challenge to do that, I can tell you. Of course, among many other ambitions includes diversity, equity, inclusion of all, because we trust that diversity is a power for the future.
Absolutely. At its core, Sanofi is a pharmaceutical company, but its mission obviously goes beyond just developing medicines. Coming back to sleeping sickness, Philippe, sleeping sickness has been a major focus of your work. Can you walk us through some of the biggest milestones Sanofi has achieved in tackling this disease?
So yes, as you just mentioned, so with your great introduction, so human African trypanosomiasis, which is the other name of sleeping sickness, is a vector-borne parasitic disease caused by trypanosome and transmitted by the tsetse fly. For you to know, it's important to remind that there are two types of parasites, two subspecies, and the most prevalent is the Gambiense species, which is living in the western part of Africa, and the Rhodesiense one, which is in the eastern part of Africa, with the rift of eastern part of Africa, where the zone are more dry, I would say. There is some slight differences between the two species and the two type of disease, but the eastern part, which is less frequent but far more acute, with the patient can die in less than 6 months. So this is very, very frightening. And the disease can evolve very quickly, as I just mentioned, with beginning of fever and very not specific symptoms, which makes difficult to identify the disease up front. And then it can evolve in two stages. The stage 1, which is more in the blood, and the stage 2, which will be more at the level of the brain. And of course, as you mentioned, this is a very terrifying disease. If left untreated, patient will die. As simple as that. When the parasite cross the blood-brain barrier, it will result in disturbance of psychiatric symptoms that will lead to coma and death. If it is not known in our developed countries, this is a very frightening disease in sub-Saharan Africa. Today, around 60 million people are still at risk in this country, where the population at risk is most in remote areas. And as you mentioned, symptoms can be very stigmatizing, with the threat to be bewitched by devil. This disease has has a lot of impact on the population. I had the chance to discuss with I would say retired physicians now, who were able to know the villages where populations were really in front of this disease. Many cases, they were speaking literally about zombies village, where it was like zombie lands. And really, this is the way that the disease were appearing in these villages. Until recently, there are only few therapeutic options for treating sleeping sickness. And the available treatment was an arsenic-based treatment with a lot of side effects. The first bad side effect was it was able to kill 5% of the patients.
Oh my God. Patients themselves, not the parasite.
No, the patient, and for the physicians, it was very frightening just to administer the drug. And the patients were describing this drug as the fire in the vein. And just for the physician, administering this drug was really frightening. And also for the patient arriving in good health, sometimes they was just dying by the treatment
Oh my
itself.
God.
So
Because of
that was really frightening. And for the physician, for the patients, and that's why I was saying that was a very, very difficult disease in this area.
Right.
And then there were some new options which were developed with intramuscular and intravenous drugs, but all with long-term durations up to 40 days at the hospitals. And of course, that made these treatments very, very, very complex for these families, which had to leave the fields, the family. For example, when I was discussing with people locally, they would say they didn't want to get to be treated because their families were there, their children were there, their wife was not able to take care of the cattle, to take care of everything, getting food, getting water, and so that was a very very difficult condition, and that's why the diagnostic by itself for this population to get the sleeping sickness was very terrifying too. In addition, before we received these new drugs I will speak about soon, there was a need to do a lumbar puncture to diagnose which stage of the disease, stage 1 in the blood or stage 2, I would say, in a more advanced disease. And the treatment was different. And imagine a lumbar puncture just under a tree, literally, it was under a tree. Yeah, our conditions, it was very frightening. But as you mentioned, we are having started collaborations for long term with WHO in 2001, where we are donating all the drugs to WHO to treat these patients, and also donating cash to put in place infrastructures in the countries with education, information, screening of the disease, and to be able to put specific dedicated structures in the countries to have the capability to identify the disease, recognize the disease, identify the parasite, treat the patients in very specific conditions, and to follow the patients. And thanks to this, we have seen some good results where it was possible to test in many areas to recognize the parasite in the blood under the microscope and to be able then to treat. Because of course, you can imagine that when you have such very difficult treatments with side effects, treatments in the hospital, before to be administered the treatment, we wanted to be sure that the patient had the parasite. And it was very important to find the parasite in the blood under a smear in the microscope to say, yes, there is a parasite, yes, you can treat this patient. But to find this parasite needs some training too. It's not so easy to find it. Sometimes you have a very low number of parasites in the smear. So you have to find it, to look at all the smear of the blade on the microscope and to find really where is the parasite. And in parallel, we have developed a collaboration with DNDi, Drug for Neglected Disease Initiative, which is an NGO, able to develop new drugs for neglected topical diseases. And they knocked our door in Sanofi because first, we were having started very long-term collaboration with WHO for many years. Second, because they identified in our library of treatments one treatment which was developed many years ago in a pharma company which is Höchst, where we were developing this drug and we stopped to develop it. And then we started the collaboration and said, okay, we will give you, the NDI, the rights to develop it. And we will work afterwards with you to register the drug and to provide access of this drug to the patients. And this is what we did. Ultimately, we succeeded in to have the first registered drug for treating sleeping sickness, which is an oral drug. The name is Fexinidazole. It's a 10-day treatment, oral drug. And today, 70% of the patients are treated with Fexinidazole, with this new oral drugs. And Today, we have been able to reduce since 2001 the number of cases by 98%.
Wow.
Oh, in 2024, the number of cases will be of less than 600 after 2 million people tested in sub-Saharan countries. So this is a great result we have been able to achieve with our partners.
Right.
So that's what I wanted to share, of course, you in terms of results. What's important to understand is that we are not stopping there. We are continuing to fight against this disease. We have launched a new initiative to find another drug, even better than the one we are speaking about, because we trust that we are able to finish the job of elimination. And that's why we have started to work for another drug with DNDi to once a day oral drug. Instead of having 10 days treatment, once a day oral drug, 3 pills taken at once. And we already know that the efficacy is great. Safety seems excellent. And we would be able with that to be even more efficient in treatment. So I think we need to keep in mind that neglected tropical diseases are very low in the list of international public health priorities and health agendas. Funding for research and developing for new treatment is typically limited, given that the potential return on investment is either very small or inexistent. That's why this innovative private-public partnership is critical to have the expertise and experience of all actors. No, only one actor can succeed. We need to have everybody on board. And for example, what we did with the WHO, we were able to put with our collaboration, long-term collaboration, we were able to put in place this infrastructure of follow-up, education, information, specific centers dedicated to treat sleeping sickness. And from there, NDI was able to go in the country and to test the new drug, because conducting a clinical trial in remote areas in sub-Saharan countries is a challenge. It's very, very complex. The NDI had to train all the physicians. They had to bring computer, they had to bring material there necessary to conduct the clinical trials. This is with ECG, etc. And of course, following properly all the good clinical practices necessary to conduct a clinical trial. So that was really a challenge for the NDI also. And they were able to do that. And this is really their specificity here. And I always say, amazing job what they were able to do. We need also the countries involved, because they have to put in place dedicated infrastructure in their country. We need some donors to support these actions, because these countries are very limited resources, and they need some donor support. So Belgium was very supportive, and also the Bill and Melinda Gates Foundation were very supportive on this. And of course, Sanofi, which was committed to give all the drugs from the past. And as I mentioned, we are developing in partnership with DNDi acoziborole, and we commit to give this new drug also until the elimination of the disease.
That's incredible, and a lot of information for me to take on as someone who's not so familiar with neglected tropical diseases. And I remember in school textbook, there was a chapter on sleeping sickness. And after that, I never came across sleeping sickness as a condition living in the western part of the world. So you mentioned that once the person is bitten by the tsetse flies, if they're left untreated, how long it takes for them to get to a situation where it just gets incurable or the situation worsens? How does the progression of this condition happen, and how long it takes?
So there are two types of parasites. The gambiasin one, which is the most frequent. Of course, it varies from people to people, but I would say that in less than 2 years, parasite will have crossed the blood-brain barrier, and then if left untreated, you will die in 2 years. If you think about the Rondeziense case, it will be much more quicker. This species of parasite is much more aggressive, I would say, and the patient will die in 6 months. So that's why it's very critical to be treated as quick as possible. This is very, very critical, very important.
Right.
And that's why also, sorry, it's just to complete. It's important to think about having the treatment directly close to the patients in the specific centers. The way we are donating the drug with WHO, because it's a rather complex also organization to be sure that in all cases which have been identified will be treated without no delay, whatever. So that means that we are giving a bulk of treatments to WHO. So it's 4 treatments on the Sanofi side. Bayer is also providing two drugs. So you can imagine that today there are 6 different drugs produced, distributed, donated to treat 600 patients. So this is realizing the efforts that everybody is going to do that. WHO is working with Médecins Sans Frontières, Doctors Without Borders, to distribute the drug as close as possible to the patients. So that means we have some hubs in the countries, in very remote areas of the countries, where the drug will be accessible very quickly, easily, to be able to treat the patient as quicker as possible, taking into account the severity of the disease.
And the procedure you talked about earlier, the lumbar puncture, is that for the diagnosis of the parasite or the presence of the parasite in the synovial fluid, or to ensure that it has not crossed the blood-brain barrier?
Exactly that. Because depending if it has crossed the blood-brain barrier, the treatment will be different. That's why we use this lumbar puncture to differentiate the stage of the disease. If it still remain in blood, it is stage 1, which is less critical. If it has crossed a blood-brain barrier, then it's stage 2, which is more severe and more difficult to treat.
Right. And how long does it take for the symptoms to surface after the bite?
Also, it's very variable. But the issue that the first symptoms, the early ones, are very, very common.
Oh, I see.
And it can be mixed with other diseases, like malaria, for example. And it can take a while before to recognize and identify the disease. And this is the issue we can have in the future, moving forward, the rarity of the elimination of the disease, because since 2001 we were able to put in place infrastructure with dedicated physicians, education, but moving forward, when there are less and less cases, just thinking about the disease will be difficult. And sometimes we can just miss it because people do not think anymore about that. We had recently, 2 years ago in Ethiopia, for example, they just had no case for more than 30 years. And 2 years ago, they had few cases.
Right.
And it took months to identify the case. At the end of the day, 2 died because they were too late in the diagnosis. And you see, so when you don't think about the disease, you can miss the case. And if you miss the case, there is only few treatments able to treat these patients.
Right. And of course, this collaboration between WHO and DNDi and Sanofi has been incredibly impactful. Can you share a specific example of a collaboration that really made a difference? Maybe a moment where you saw the power of working together in action.
Yes, in the collaboration, for me, there are important keys. So the one is we need to have different expertise and to bring the knowledge of each one, to be really inclusive, to say, okay, this is you have this expertise, and I recognize the expertise of the others. First, we need to think in long term also, because this is for sure long term. You cannot develop a drug in 1 or 2 years. So we need to be reassured on the fact that you will put in place teams, infrastructures to be able to work on long term and reassure on the long term basis.
Right.
And you need to understand the differences of the others. Nothing to compare between a big pharma company like Sanofi, WHO, an international organization, multilateral, a small structure like DNDi, very efficient, very reactive. These organizations, we were all having the same, working to develop new drugs, elimination of the disease. But the interest and the objectives of these organizations can be different, because the environment of each organization is very, very different. And sometimes it can be difficult to understand that It will take ages in Sanofi to make a decision when in a small organization where they discuss with the boss every day. It's
Yes.
quicker. Or even when you discuss with the WHO and say, oh, by the way, when will you update your guidelines for treatment? And it takes months. And you say, why you take months to do that? And all of this. What is important also is to bring all actors, all people who are able to bring in. Like, for example, I was pushing a lot when we developed Fexinidazole for registration with a dossier submitted to Europe. I said we need to have the countries involved in the discussion, in the review of the dossier, far before receiving the drug. So then the Minister of Health in the countries, some countries which will receive the drug at the end, which will use the drug in the end, were involved in the discussion, were involved in the review of the dossier. That means that the day we had an EMA positive opinion on the drug, the countries were trusting the drug and they were able to give their registration in very short period of time. And this is also saving lives of patients.
Right, right. And you mentioned earlier that along with WHO, Sanofi and DNDi, you have this ambitious goal of eliminating sleeping sickness by 2030. I mean, that's huge. What's the strategy behind this and what partnerships are helping drive this mission forward?
Yeah, so of course, this is one step further. So
Yes.
we are following the WHO neglected tropical disease roadmap, which is elimination of sleeping sickness by 2030. No transmission case. So this is as simple as that. Of Sanofi, we are committed to help, to continue to support, to continue to give the drug, and we continue our collaboration with all the partners.
Right.
But we need also to extend this collaboration to succeed in the elimination. We need to extend to the people who are doing the test. Because in the context where we will have less and less cases, we need to have accurate and reliable diagnostic tools to succeed, because to find the case will be more and more difficult. And as I mentioned before, the standard definition of case is a demonstration that the parasite is in the fluid through the microscopy. As mentioned, there are some situations with low parasitemia. It's complex to find the parasites, and we can miss some cases. WHO written target product profiles for diagnostics and to develop new tests able to recognize much more easily the sleeping sicknesses with, for example, with a rapid diagnostic test which is existing today in antibody, but ideally we have a molecular test. It would be much more efficient, much more I would say reliable. And there are some activities on developing these tests, but it's still a lot of work. It's another expertise, another field, and we are discussing a lot with DNDi, with WHO, to know how we can improve the test and work with partners to do that, to have a more specific test, to have more sensitivity, and to be able to recognize much more easily the disease. Even if, of course, in the future we'll have very efficient treatment. A very efficient treatment if we are not able to recognize the case. And there is also, if we move forward elimination, as I mentioned, we mentioned that there are the tsetse fly transporting the parasite. And of course, there is also actions on limiting the number of tsetse fly. That makes sense to reduce the number of tsetse. And there are some actions put in place in the most at-risk zones where there is some nets, blue nets, because the tsetse fly is attracted by the blue color for any reason. And on the net we put insecticides, and then the tsetse is moving to the blue to the net, to the blue net, and then they die. So this is one way to control the number of cases of tsetse fly. And we need to think about possible animal reservoirs can transport the parasite too. And this is a situation we need to control also, and work with our veterinarians colleagues to see how we can put in place some actions to limit also the fact that some animals can transport, especially the cattle, can transport or can be infected by the parasite. So this is the kind of actions we need to put in place. And in the context where, at least in the governments, sickness will be less and less a danger or a political point, because there is almost no case. And why to involve money, to put resources in this disease, which is almost eliminated, and there are some other many cases in dengue, in malaria, tuberculosis, and say, so why I should continue to do that? But why is that if we continue to all our efforts, if we continue our partnerships, if we continue to test and develop these drugs and develop the new tests and continue to monitor the disease, eliminate the disease. As I usually say, if we are able to eliminate this disease from the planet, the first ever time we eliminate a human fatal disease without a vaccine. That will be the goal. Of course, it will take a while. It will take still many years. But if we can imagine a world without any risk of transmission of sleeping sickness, it will be, of course, a big move, a big shift. Knowing that even we are speaking about remote areas in Africa where the sub-Saharan population is more at risk. But if we think also on the Rhodesian cases, which is a eastern part of Africa, this is a place where you have safaris for touristic activities in these areas. And with the new drugs we have developed, now we have started to treat Danish, Austrian, American people coming back from these areas, having contracted sleeping sickness, the Rhodesian case, the most acute one, and desperately happy to use these new drugs we have developed for these neglected populations. So you see.
Yeah, and I wonder if physicians in this part of the world know about tsetse fly, and do they know how to diagnose this condition and what's going on with the patient when they see the symptoms?
Yeah, so because of this partnership we have put in place with WHO for many years, the knowledge of the disease, the physicians who started with being an expert in this disease for many years, now are getting more and more retired. And for the new physicians, doing studies on sleeping sickness, not the future. It's some kind of dying disease because it's moving forward elimination. Why they would spend their career, energy to just diagnose and recognize or treat a disease which is almost not existing anymore?
Yeah. Exactly.
And this is a challenge also we will face moving forward elimination. That's why I come back to the diagnostic piece. The diagnostic, if it's embedded in another test, like the malaria test, for example, we can do the test very quickly, very easily, without thinking about it. And if the test is saying, oh, by the way, it's a sleeping sickness case, then it's easy to send it immediately to a dedicated center, and that would be much more easier.
Right. And just to try and get a sense of the level of infestation in affected areas, so do you really have to go into the rainforest to see tsetse fly, or they come into the homes as well?
Really, the cases are in very remote areas to parks. So if you go directly in big centers in the cities in Africa,
you won't come across.
You will not be at risk. It's really now in zones in war, for example, or close to parks where nobody's going.
Right. Okay. And another question for you, Philippe. Local healthcare workers and community organizations are often the ones who make sure these treatments reach patients. How do they fit into Sanofi's approach to tackling sleeping sickness on the ground?
Yeah. So for Sanofi and for me, of course, these physicians, healthcare workers in the field are at distance because I've been only once, unfortunately, in a endemic country, because I have reliable partners going there. There's WHO is going there very often. DNDi is going there very often to be sure that the drugs we are donating is
Mm-hmm.
going to the right person in enough quantity. So we are able to conduct the stock of the drug. And also there is some trainings about the drug locally. One interesting thing also we have done in collaboration with WHO and DNDi is the training on pharmacovigilance,
Oh, see.
on safety follow-up of the drug in the field, on the use
Mm-hmm.
of the drug. Because of course, when you develop a new drug, fully new drug, new chemical entity, which have
Mm-hmm.
never been used elsewhere, and you will use it in these countries where the medical infrastructure, even pharmacovigilance knowledge is
Mm-hmm.
limited. It's very important to be sure that these drugs would have exactly in the real life
Mm-hmm.
the same profile as we did during the clinical trials. And that's why we also funded a
Mm-hmm.
collaboration with WHO
Mm-hmm.
to put in place education about how to collect the safety data for Fexinidazole, for example, in the field. To be
Right.
sure, we are collecting all the accurate information. This information is sent afterwards to the WHO, and WHO is sending afterwards to us to be able to
Mm-hmm.
confirm to EMA that
Mm-hmm.
the profile of the drug we have registered is
Mm-hmm.
aligned with the real life. Knowing that, as you can imagine, that finding patients in the clinical trials is very difficult. So it was very limited numbers of patients
Yes.
treated in the clinical trials. And we want to be sure that, again, on the field, when we have higher numbers, we are comfortable with the safety we have seen. That's why we have put in place a dedicated, specific follow-up of the drug
Right.
and in the field with all the
Mm-hmm.
healthcare workers and the physicians.
Right. And although sleeping sickness is just one piece of the puzzle, I know Sanofi is also tackling other global health challenges like pediatric cancer and climate resilience. The role of the private sector in global health is evolving. How do you see companies like Sanofi continuing to shape the future of healthcare, especially in underserved regions?
So this is a difficult question, specifically in the context we can see today. Of course, the global health is changing very quickly at the moment.
Yes.
And what I can tell that we are committed to continue what we do in terms of insurance, that we are working very hard to provide access to patients in the field, as I mentioned, to continue our
Right.
philanthropic actions, to continue what we do today with sleeping sickness patients. So I think this question will be interesting to be asked within 6 months or
Mm.
1 year.
Yeah.
We'll see how the world is completely shifting,
Yes.
taking into account the shakers we
Yeah.
have in all areas at the moment.
We are seeing some turbulence right now in this
Yes,
area.
yes. And
Let's.
of course, the private sector will continue to play a critical role because the private sector is very important to provide access, as I mentioned. But we cannot do anything. The private sector cannot and will not just compensate what the public sector will stop to do. And this is where I think we need to think about how in this new world we can and see
Mm.
how we can limit as much as possible the impact on some public actions.
So, on a personal level, Philippe, what has been the most rewarding part of leading the neglected tropical disease program?
Yeah. So thanks for this question because of course it is critical when you are working every day, you are motivated for a topic and it I can tell it is a lot of rewards because you can see definitely the output of what you do. So you can live what you do. You can meet patients having changed their life in the real
Absolutely. Absolutely.
really. And this is of course the most rewarding part. And even in my previous job in Sanofi, but in vaccines area, when I was putting in place some programs of childhood vaccination, others coming to me and say, thanks for saving my child. So we say, yes, I'm doing something good. And this is, of course,
Right.
very, very important. But what is what was the most exciting part for me was to be able to make all the partners, despite their differences, working together.
Mm-hmm.
And I can tell this is my day-to-day work. Having this full collaboration mindset all the time in front of difficulties, because there are some difficulties, I can tell.
I can
We are
imagine.
able to face it, whatever, despite our differences. That is a challenge, but this is what I like really to do and say, okay, we are a team. We continue to succeed as a team, and whatever the difficulties, we will pass the hurdles. This, I think, the real true reason of my work today is to make that.
Right. And it's really inspiring to see how different organizations with different cultures, different resources, different priorities, they all come together for one mission and they make such a massive impact on the ground. And I think you are making such an incredible impact along with your colleagues and with the wider ecosystem. I think it must be incredibly satisfying to see the impact of your work on the ground.
This is also an inspiring goal, which helps also motivating the Sanofi people and also internally, because I can tell that the resources are stringent, more and more stringent, and the pressure is on the people more and more in the companies. But when they trust on what they do, when they see the result of what they do, I think it's a lot of reward. And one of the challenge also I had was to be sure that we keep the best resources, best expertise, best people in this project. While of course they had many others, these best people were having many other opportunities in the group, in the companies elsewhere.
Yes.
To say, okay, I am called for a much bigger priority of the company, much other important thing. But because they trust in it, they say, okay, I will continue to work with you in your project. And even the big bosses, I say, okay, I have no resources in my team, but I will do it by myself to be sure that you will have the resource, you will have the expertise to do that, because I trust it is for good. And I think having this mindset, this team all together, that's really the way it works. The best way also to keep the best people. We will not succeed again if we don't have the best ones.
And Philippe, there must be moments that really stick with you while being involved in causes like these. Is there a particular patient story or experience that had a profound impact on you and that stayed with you?
I come back to what I just mentioned about the situation where I was going in vaccination centers in Philippines, in very remote areas in Manila, where I had mothers coming to me. Say, hey, you are doing great things for my children. And this was completely conflicting with what we see in our Western countries, where people have vaccines when they want it, and they say, oh, I don't want it. And as I mentioned also during my last trip in Malawi, having met with a father, having his daughter treated with Fexinidazole, his daughter having treated with a child, which she was, and then to come back to have all the story of the father, the daughter, having the child with her, and see their story, really story, being in the village, see how they live, where they come, and being so thankful of what we do here. And that was really impressive. And also discussing with physicians who treated with very difficult conditions in the past with this arsenic drug. You cannot imagine how this could be difficult. And they were speaking about their stories, about how they were feeling when treating these patients, how they were in front of the families when there was some, as I mentioned, a patient dying of the drug. It was so difficult. And when you arrive with a new drug, completely different treatment, they say, wow, this is a fantastic. This is of course very, very rewarding.
For young professionals looking to make a difference in global health, do you have any advice?
So it would be rather basic. So first, you need to work hard, of course. This is the first start. We cannot do anything if you don't work on yourself with others. You need to collaborate, because no one has the knowledge of everything. You need to seek advice, to listen, and really to understand the other stories, these stories. Even old people, which could be looked at old-fashioned, etc., they can bring things, interesting things. And being in his world, of course, and the young generation can bring much more things with artificial intelligence, for example. They will be much faster, but no one should especially the young ones, should forget to collaborate. The solution is not in the iPhone or computer. The solution
Yes.
is working together and change also our bias. We all have a bias because of historical reasons, and do not judge the person you have in front of you just by what you see or by what you clear in which box you put the person. Very important to this is mixed with listening, because again, often people are just thinking that this person is coming from there, so I have no hope on this person. Do not trust your bias. Go there and hear different stories, hear different ways of doing, different ways of living, and you will learn all the time. And of course, learn. Actually, when you are young, you never learn enough and continue to learn. This one, some basic recommendations.
And Philippe, for anyone listening who wants to support or get involved in this work, what's the best way for them to do so?
So we will have the most needs, as I mentioned, is diagnostics. So if there is anybody in your auditors having a good expertise in diagnostics, working with biotech, big pharma, so yeah, so they are welcome to
Right.
bring their expertise here, because it's there are some working already in that, but I think it's a real need. And Sanofi is not a diagnostic company; we are a pharma company, which is
Right.
we don't have this expertise, but of course this is a call for having expertise in diagnostic, so adapted to this sleeping sickness disease. And also the call is to all the funders who have worked so many years to contribute to eliminate sleeping sickness. Do not stop, especially at the moment where we
Yes.
are on the verge of reaching the elimination. The risk, especially in this global health environment, where the challenge would be finding new fundings, and they will have prioritizations of this. The risk will be very high to shift from this disease, which is not a political issue right now, to other diseases which are much more visible. But we should not forget that if tomorrow we stop to control sleeping sickness, we will have a rebound of the disease, and that happened in the past. That's why it's very important to continue to donate, to continue to focus on this, and to succeed on the elimination.
And another question for the benefit of our young students who are watching the show. Does Sanofi or Foundation S offer any internship opportunities to students who are pursuing population health management, or they intend to make a career there, or they're studying the subject?
Yeah, definitely. We have worked with students coming for trainings in the department of tropical disease, but also at the Foundation S, we are working with students too. Definitely, yes, we are opening opportunities to work with us and to bring their expertise and to build together on the projects we are developing.
Right. And before we wrap up today's episode, is there one message you would like to leave listeners with about why tackling neglected diseases and global health more broadly requires collective action?
I think that all what we do for neglected tropical diseases will benefit for the planet globally. I just mentioned about the fact that some Europeans going to safaris in Africa were benefiting already from all the investment we are giving. Now with dengue is a neglected tropical disease too. Dengue, there was a lot of work with this neglected tropical disease done. But now we see that dengue is moving to the north and reaching the rich population. We have seen with Chagas disease, another neglected disease. Now with the move of population in Spain, for example, the Chagas disease is more frequent in Latin America. Now we have more and more cardiac events in Spain due to migration of the populations. And now this is a problem in Spain. This is in the future would be a problem in the US. So my call is all the actions we do is not just philanthropic actions for the poor. What we do is also for us. For us, this is for the whole planet. If tomorrow we are able to eliminate a disease, this will not be beneficial only for the neglected population in sub-Saharan countries. It will be beneficial for the whole planet, for everyone. So this investment is critical, and this investment is beneficial for everyone. So this would be my message.
Well, that's a very, very powerful advice, and I loved everything you said about the fact that it's not just about treating or helping one region, but we are helping the entire planet by contributing towards the fight against sleeping sickness.
Yeah.
Philippe, that was an absolutely eye-opening conversation. Thank you so much for sharing your insights and for the incredible work you and your team are doing to tackle sleeping sickness and other neglected diseases. And it's clear that the impact of this work goes far beyond medicine. It's about changing lives, transforming communities, and bringing us closer to a future where no one suffers from a preventable disease. But this story isn't complete yet. In the next episode of this special series, we are diving deeper into the power of collaboration. We'll be joined by experts from both Sanofi and DNDi. We'll have Philippe again to explore how their partnership is making an impact on the ground, what it really takes to eliminate a disease, and the challenges they are still facing. You won't want to miss it. Until then, if you found today's episode valuable, consider sharing it with someone who might not be aware of the fight against sleeping sickness. The more we talk about these issues, the closer we get to the real change. Philippe, once again, thank you very much for your time and for everything you and your team are doing. And to everyone listening, thank you for tuning in. See you in the next episode. Thank you.
Thank you very much, Kaushik.